Hello everybody. Today again back with a little talk on sensory issues of autistic spectrum disorder. I have discussed a little bit about the sensory, that is maybe hypersensitivity, sometimes hypersensitivity. So how these issues look like, sensory issues. Many people, autism shows certain behavior when they are experiencing the sensory issues, increased movement like jumping, spinning, crushing to things, increased stimming such like hand clapping, making repetitive voice, rocking back and forth, talking first louder or not talking at all, covering ears and eyes, difficulty in recognizing internal sensations like hunger, pain, the need to use the bathroom. So, refusing or insisting on certain foods or clothes, frequent chewing on non-food item, frequent touching of others or playing rough, difficulty in communicating or responding as brain shifts resources to deal with sensory input, escalating overwhelming emotions or need to escape from the situation that causes meltdown, either shutdown or meltdown. So basically all these things can be looked like that. Now, accommodations for sensory issues. Understanding and accommodating sensory issues can ease discomfort and increase the opportunities for that autistic people to learn, socialize, communicate, participate in community. Accommodation means modifying the environment using the tools and strategies or creating new habit or routines. Since sensory needs depends on environment, accommodation may need to be adapted for each setting. Example of I'm giving some example of accommodation for hypersensitivity. For if they are very hypersensitive to light, use the light cover, sunglasses, hat, under fluorescent light, wearing the earplug or headphone in noisy environment, working in spaces with closed door or high wall, avoiding strongly scented products, choosing the food, avoid the aversion to texture, temperature, and spice, wearing soft, comfortable cloth, adjusting schedules to avoid the crowd. And for hypersensitivities, example like visual support for those who have difficulty in processing spoken information, use the fidget toys, chewies, and other sensory tools, arranging furniture to provide safe and open place, talking frequent movement break throughout the day, eating foods with strong flavor, mixed texture, weighted blanket, lap pad, clothing, provide deep pressure. So all these things are an example of hypersensitivities, accommodation. And you can ask the autistic people reasonable accommodation at work and school, and that will give that, uh, it will, there are a lot of supports there about it. Of course, self advocacy we can find also in the sensory issues. So basically, self advocate for sensory need to be made, and this starts with learning about how you understand in the need and needs, so that you understand what works or what does not work for you. So basically it also about this two-way person. You have to just discuss with that person who is taking this. So basically and also other things like that, self-empowerment roadmap of autismspeaks.org. Also employment toolkits are there, and other resources are also there like occupational therapy, speech therapy, cognition behavioral therapies. So basically all these things can help in this. Hope this is help a little bit about increase awareness about sensory issues related with autism. Thank you for listening, and hope to join you again next week with another small talk. Bye for today.